Okay, good morning and welcome. I have been told that Hendrix and Bill are not going to be doing a general overview and reflection, so I will welcome you here this morning. Thank you for being here. We had a really interesting and stimulating day yesterday. I'm looking forward to the same today. I'm just going to do some really brief introductions and then we'll get right into our panel. So I'm Dara Blackman-Demner from the National Institute of Justice, a member of the forum, and I'm really excited about this panel. We're going to be focusing on the use of quality measures to facilitate system change, and I think we have a really great panel with diverse perspectives. So we'll be talking about early childhood, juvenile justice, and the healthcare setting. I'm just going to do a really brief introduction of our panelists. You can read more about them in your program. So first we have Rachel Gordon, who's a professor in the Department of Sociology and Associate Director at the Institute of Government and Public Affairs at the University of Illinois, Chicago. And her research broadly examines contextual, social, and policy factors that affect children and families. And she'll be talking with us today about childcare and preschool quality and the use of some measures there. Kristen Krake is a colleague of mine, social science specialist at the U.S. Department of Justice's Office of Juvenile Justice and Delinquency Prevention, and she serves as a senior technical expert in the area of juvenile justice systems improvement, evidence-based practice, research, and resource development, particularly focused on youth justice and trauma and children's exposure to violence. Harold Pincus is professor and vice chair of the Department of Psychiatry and co-director of the Irving Institute for Clinical and Translational Research at Columbia University, and also director of quality and outcomes research at New York Presbyterian Hospital. And finally, last but not least, Sarah Scholey is Vice President of Research and Analysis for the National Committee on Quality Assurance, and her research on measurement of practice systems in patient-centered care has informed the patient-centered medical home program. Without further ado, I'm going to turn it over to Rachel.